afternoon. Thank you for joining us today. Although you can always follow me on Facebook, Twitter, and Instagram to get daily updates, I think it is also important to communicate this way at least once a week during this pandemic. I'd like to provide some updates today about the overall response here in Oklahoma City, and then I'll turn it over to Dr. Patrick McGough of the Oklahoma City County Health Department for some specific updates about the public health response. As of today, in the Oklahoma City Metro, which I define as Oklahoma County, Cleveland County, and Canadian County, we have a cumulative total of 701 confirmed cases and 32 deaths. We have had 18 more deaths since I stood before you just a week ago. On behalf of the people of Oklahoma City, I send our deepest condolences to the families of those we have lost. Before I get to some specific updates, I want to address at least two big picture questions that I imagine are top of mind for you as we all try to navigate this extraordinary moment in history. To those two questions, I'll try to deliver the best answers I can. The first is, how are we doing? I feel this question may seem to have a murky answer because numbers without context can be mind-numbing after a while. And our residents are hearing these staggering case numbers and sobering death totals, while at the same time they're hearing phrases like cautious optimism. It may seem as if these things cannot coexist, but in fact, in the context of COVID-19, they can. The short answer to the question of how we're doing is that relative to a normal virus, things are not going well at all. But relative to what COVID-19 is capable of, we're maybe doing okay. Let me expand on that. COVID-19 is an extraordinarily impactful virus, and the world has come to learn that no matter how much you try, it can't be stopped in its tracks. But you can limit its impact. In the state of Oklahoma, despite social distancing measures in place that haven't been seen since 1918, we have suffered more deaths from COVID-19 in just 3 weeks than we had seen from the flu this entire flu season. By any normal measurement against normal viruses, we would have to say this is not going well at all. But at the same time, we know from experiences in other cities around the nation and around the world that the fallout from COVID-19 can be worse. Our 32 deaths in the OKC Metro so far amount to about 2 deaths for every 100,000 people who live here in our metro. In the Lombardy region of Italy, a place that was hit hard and early by COVID-19, there were 100 deaths for every 100,000 people living in that region. In New York City, they have approximately 60 deaths for every 100,000 people. Even closer to our backyard, in New Orleans, just 700 miles from where we stand right now, they have 46 deaths for every 100,000 people. These staggering death tolls in cities both near and far are why we have taken this seriously. It is also why we can look at our own sobering death totals and observe that it could be worse. We have some evidence to now believe, with cautious optimism, that our social distancing is working. We are suffering sickness and death far worse than we are used to when it comes to viruses, but we have thus far staved off the worst that COVID-19 can bring. And for that, I say, good work. Having said that, this past week we have also suffered some of our deadliest days and our biggest jumps in confirmed cases. Since I stood before you a week ago, our case total has nearly doubled and our death total has doubled. We are right now in the middle of this fight against COVID-19, and it is no time to relax our efforts. This brings me to the second big picture question I expect is on your mind. When does this all end? In a sense, I don't know the answer. I can't possibly know the answer, but I'll share what I do know. As I discussed last week, I think we've all gone through a kind of grief as we grieved the way of life we knew prior to COVID-19. I suppose we all get through the stages of grief at a different time. And though many of us have worked our way to acceptance, I recognize not all of us have. There are still those who want to think we can somehow choose to end this, or that everything would just return to normal if the politicians would let it. As far as that goes, let me tell you, Most people staying home are not doing so because of my proclamation. By far, the most powerful proclamation is the one written by the virus. People are staying home because they don't want to die. Those who have listened to the data I have shared or have taken time to do their own research understand we are living through a 100-year pandemic. They've seen the numbers I cited earlier from places as far-flung as Italy and as nearby as New Orleans. They understand this is unlike anything we have faced in our lifetime. The virus is contagious and it is deadly, and it is working its way through our city right now. The government could lift restrictions tomorrow, but who in their right mind would change their behavior even one iota? Here's what I know. Serious discussions about life returning to normal can't really begin until the virus's spread has significantly lessened. And also, life almost surely won't return to what we remember as normal for a very long time. It may be that once we pass the peak of this virus, and when testing is far more abundant than it is now, society will begin to take some cautious steps forward, calculated, targeted steps. But it will almost surely be gradual. Some of the highest risk locations and activities may not return to normalcy for many months. And that will probably have very little to do with what government officials are saying. It will be common sense. It will be guided by science. Here in Oklahoma City, we will listen to the CDC, we will listen to our local public health officials, and we will follow the best science that the world has to offer. And we will prioritize life. Today in Oklahoma City, we are right in the middle of this fight. We are sheltering in place through at least the month of April. I want normalcy just as much as you do, but no proclamation is going to bring normalcy. Every single one of us is a part of this fight. We each have a role to play. For most of us, that role is simple. Stay home, except for essential employment, essential errands, and outdoor exercise. And if you do go shopping, if it is at all possible, please do so alone. I commend the many essential retail establishments that this past week have put stringent social distancing measures in place. I urge all essential retail to do the same. And if you have to be in public, please wear cloth face coverings in public settings where social distancing measures can be difficult to maintain. But do not take a false sense of security from those masks. Please continue to keep your distance. And of course, if you are outside your home for any reason, whether it be an essential errand, employment, or physical exercise, keep your distance. To the extent you can, let's enjoy the best that this new normal has to offer. Keep enjoying family movie nights, family dance parties, FaceTime reunions, and neighborhood walks. And let's continue to think of those on the front lines of this pandemic who are called upon to do much more than just stay home. We are all so grateful to the people who are bearing the load of this pandemic in ways we can only imagine. Thank you to those whose economic sacrifice is saving lives. Thank you to the doctors, nurses, PAs, nurse techs, pharmacists, home health care workers, IMSA workers, nursing home and assisted living workers, hospital workers, medical researchers, mental health workers, and all those in the healthcare field. Thank you to the teachers, the school administrators, the school support staff, and school nutrition workers. Thank you to the grocery workers, the restaurant workers, the grocery shoppers, the food delivery drivers, farmers, and ranchers. Thank you to all law enforcement and firefighters and those who work in the field of domestic violence. Thank you to e-commerce workers, the truck drivers, postal workers, and all delivery drivers. Thank you to food bank workers and volunteers. Thank you to the public health officials and elected officials and government workers across the board, including utility workers who keep our water and sewers functioning, or pick up the trash, or operate public transit. Thank you to electric utility, telecommunications, and IT workers. Thank you to plumbers and electricians. Thank you to the members of the media bringing us so much important information. Thank you to faith leaders working to tend to our spiritual health. Thank you to cleaning staff across our city who often do their important task after everyone else has gone home. Thank you to the chambers of commerce and other associations and government employees working to support our small businesses or those who are unemployed. Thank you to nonprofit staff, and especially those supporting those living on the fringes, especially those experiencing homelessness. Thank you to bank staff, gas station employees, auto repair workers. Thank you to all those who take risks each day to ensure that the rest of us can stay home. This week, the Oklahoma City National Memorial relaunched the Oklahoma Standard. This concept was first created organically in the wake of the Oklahoma City bombing in 1995. Today, the memorial works to remind people of the values that are its foundation. Those values are service, honor, and kindness. And I can think of no better reflection of those values than the work that is being done by all the people I just mentioned. Let's follow their example in our own ways and in our own lives. Let me leave you with another reminder of what we fight for. Richard Waltz passed from COVID-19 this past week here in the Metro. He was a career firefighter known across the state's firefighting community. He helped found the State Firefighters Museum that I can see out the windows of this building. His son Patrick wrote about his father this week. Patrick wrote that his father's integrity was unwavering. He spoke of how proud he was of his dad. Patrick's mother was able to be with Richard when he passed because she too has COVID-19. But Patrick had to say goodbye to his father over FaceTime. In a letter he posted online, Patrick wrote, "Please be careful out there, people. You don't want this." Indeed, you do not. We have worked every day to put in place the infrastructure so that you don't have to suffer the terrible effects of COVID-19. Please take this seriously. Please do your part, shelter in place, and let's all get to the next chapter of our city's story together. And finally, to all those celebrating Passover or Easter this weekend, I send my sincere best wishes. This is a community with a strong faith. That faith will help lead us through this pandemic, and ultimately we will emerge with a stronger faith and a stronger love for each other. With that, I'd like to welcome our partner, Dr. Patrick McGough of the Oklahoma City County Health Department, to the stage to provide some medical updates.
Thank you, Mayor Holt, for that and for your great leadership. We are now in week 4 of this response in Oklahoma County. The Oklahoma County Health Department's testing site has now tested more than 1,600 individuals in the past 2.5 weeks. We received notice that the reporting of our lab results was lagging and have transferred that responsibility in-house, and so a drastic improvement should be noticed soon. Our staff will be working over weekends, making phone calls to see that all the test results are reported. I want to mention that testing remains critical in our fight against the spread of COVID-19. However, we now have a new development to help the most ill hospitalized patients with COVID-19. Linked by the Oklahoma State Department of Health, the Oklahoma City County Health Department has developed a partnership with the Oklahoma Blood Institute to obtain plasma donations at one of our clinics from fully recovered COVID-19 victims. This will allow us to provide antibodies to those most in need. Some additional good news to report is that hospitalizations are down in Oklahoma County and across the state. Our social distancing efforts are beginning to work. We are slightly decreasing the burden on our emergency rooms, and hospitalizations are trending down slightly as well. This is good news, but to keep it that way, we can't let our guard down. We must continue our mitigation efforts to stop the spread of the virus. As we approach the Easter holiday weekend, I urge everyone to celebrate or connect with loved ones virtually. When you have to be outside of your home for groceries, medications, or other types of our have-to items, please remember social distancing. It equals 6 feet or greater. Remember 10 or less people in a room. Wear a face mask when out in the public. Urge your family, employees, and coworkers to do the same. And I appreciate Mayor Holt's advice that sometimes the face mask makes you feel a little more protected and people tend to gather a little more closely to one another. Be careful that you do not do that. Even when you're wearing masks, please keep your social distance of 6 feet or greater. Please remember to wash your hands frequently and often and stay home. Again, please do not visit the homes of family, friends, and loved ones this weekend unless you do so by video or phone. Per CDC, it is also important to remember to only call 911 for true medical emergencies, such as trouble breathing, persistent pain or pressure in your chest, new confusion or being incoherent or having bluish lips or face. Again, CDC is recommending that folks remember to only call 911 in these instances. However, if you have other medical concerns, please contact your medical provider over the phone or via telemedicine. I know that many of you are not only worried about COVID-19, but you have other chronic health conditions you are still facing. Please remember to continue taking care of your health by connecting with your doctor over the phone or virtually during this time. While you may be anxious about visiting with the doctor, your health and well-being is benefited by ensuring you're receiving appropriate medical advice, even if it is done virtually. You and your physician can then decide together if you need to visit in person to address an ongoing medical issue not related to COVID-19. I want to applaud and celebrate the residents of Central Oklahoma for taking our advice seriously. You have created your own mask at home and are wearing them to the grocery store. I see you. You are walking in your neighborhoods but taking caution to stay at a distance from others doing the same. Your neighbors see you. You're connecting virtually with friends and loved ones instead of meeting up to visit in person. The entire social media world sees you. These are all great practices that are reducing the spread in our community. However, there is still work to be done. We continue to receive reports of large gatherings taking place. These are even making the news in certain instances. So I urge you, please stop gathering together with other people. It is my hope that the individuals who attended these large gatherings this past week will be spared from contracting COVID-19. But there is a good possibility they may have put themselves or the lives of those that they love at risk. Attending a party, a church service, or even a small gathering at your neighbor's house this weekend could put you, your family, and your loved ones at risk for COVID-19. Please stay home this weekend and stay safe. Again, I want to thank Mayor Holt and his team. I want to thank all of our national, state, and in particular our local partners for all that they've done for our ongoing help with homeless, our testing site, our call lines, our plasma donations, our requests for help with PPE, and donations to our foundation. Again, a special thanks to Mayor Holt, the Oklahoma City County Board of Health, nurses, doctors, hospitals in particular, and to all the OCCHD clinicians and epidemiologists, and to our entire team. Thank you. Please stay home this weekend, shelter in place, stay safe.
All right, I have a list here of media, and we'll take a question from each of you, starting with KFOR. If you would identify yourself and tell us who you would like to address the question to, please.
Yeah, this is Angela Shen with KFOR, and my question is for Dr. McGuff. Last week you said that there was enough PPE to last through this week, and you still weren't sure of the amount of lab components. So I was wondering if you could give an update on just where those supplies are now.
Certainly. We are definitely seeing an improvement since last week on the availability of both the testing components and the PPE. We still don't have the ability to do planning for days and days in advance, which makes it difficult. but we have been receiving enough PPE and enough lab components to complete testing from day to day, and we are receiving it in a more timely fashion, and we are receiving a greater volume. But excellent question, thank you.
All right, next question is from the Oklahoma City Free Press. If you would tell us who you would like to address your question to, and then get on with that.
Yes, Dr. McGuff, can you hear me okay?
Yes, sir. Yes, sir.
Okay, good. Dr. McGuff, quite a few of our readers are asking about testing specifically. You might have mentioned that here, but I missed it. Could you just talk a little bit more, expand a little bit more about the current state of testing here?
Certainly. I would love to talk about that. So we continue to have our testing site here in Oklahoma City, and what we're doing is we've widened those testing opportunities. So now everyone that wants a test can call our triage line and they can request an appointment. And what will happen is a person on the phone will determine if they meet the criteria to be tested. So again, we certainly accept those from physicians who have been referred to us, those that are frontline healthcare workers that we're trying to return to work as quickly as possible. And then now it has been opened up to everyone, but still requires an appointment and also for you to be triaged through the triage line. And if there's something about that I didn't fully answer for you, please let me know.
Dr. McGuff, one more follow-up question here, and then I'll let others get their turn. So, you know, one of the ways that South Korea controlled their outbreak so well was by massive testing, and it sounds like you were still limiting the number of tests, which is the real point of concern for most of our readers. Could you comment on that, please?
Certainly. So as everyone knows, nationwide testing is still an issue, and the capability to test and just receive unlimited supplies for that is still an issue. However, it is greatly increased, and what you point out is a very valid point, which is what always takes us back to transmission, and that people need to continue to treat themselves as if they have the potential for infecting others and that others could potentially infect them, because our testing has been limited to this point and continues to be somewhat limited, even though it's really, I said 2.5 weeks, but it's been probably more, I don't know, 8 or 9, 10 days, something like that, that we've actually had a clinic going by the time that I put the report together this morning in a full fashion. And we have been able to do so without canceling any of our clinics. And we have tested already over 1,600. And if I'm not mistaken, I think we have the largest testing site in the state of Oklahoma. And I wish that we could do more, but it is about, we can only plan ahead for so many days at a time. When we get to the point where we know we have unlimited testing capability, then we can, just kind of open it up much more broadly and see many more people. But we're continuing to do the appointments to prevent any type of chaos.
All right, we have the Oklahoman's Bill Crum on the line. Bill, go ahead, please. Your question to who?
Hi, Ken. This is going to be for Dr. McGuff. First, very quick question. How many, to follow up on these questions about tests, how many days of supplies do you currently have right now?
So I would say that right now that we're looking at, based on what I heard yesterday afternoon, and so I'm sorry that I don't have that fresh right before stepping on this. I should have probably done that, but things are quite hectic. So I think that we're good through probably Thursday of next week is my understanding. And so we will continue to make appointments through that time. And then what happens is earlier on, we were receiving enough testing components and enough PPE that sometimes we were a day at a time wondering if we were going to actually open the next day. But that has already improved, and now we've been looking at 3 and 4 days out, and I greatly appreciate that.
All right, we have
Okay,
KOCO. KOCO, you're next with a question. To whom, please.
Still had a follow-up on it.
Channel 5, if you're there, go ahead with your question.
Hey, can you hear me?
Yes, go ahead, please.
If Phil had a follow-up, I'll let him go.
Okay, Bill, go ahead, please.
Yeah, Dr. McGuff, I just wanted to make sure I understood. Did you say you have supplies sufficient to get through the entire next week?
I think right now what we're looking at is 4 days next week, and I would actually have to talk.
4 days?
Yes, I think through Thursday next week we're good. We are completing today. Historically, the Oklahoma City County Health Department, this is a holiday, but we've asked our team to continue to work in providing that, and they'll be doing the call lines through the weekend as well, calling results. But thank you for your concern about that, Bill. It is a serious thing, but it's drastically improved in the last several days, and mostly this week. Thank you.
And if we say 4 days, we mean Saturday, Sunday, Monday, and Tuesday through Tuesday, roughly.
No, sir. Our drive-through clinic is open Monday through Friday, and so with that, I'm talking about we're good through Thursday of next week.
All right.
Okay.
Channel 5.
And no testing Saturday and Sunday this week?
No, sir. That is correct. KOCO,
Okay,
please go ahead.
Thank you. Mine's for the mayor. As I'm sure the mayor knows, some towns have gone to mandatory face masks and things like that. I know our shelter-in-place goes through the end of April. Right now, Mayor, what are you looking at in terms of any additional restrictions or possible restrictions after the end of April, or is it not?
So the question is, what about additional restrictions, and what about the current timetable of all the proclamations going through the end of April? I'll continue to listen to public health officials about any additional restrictions. Right now, there's nothing. We're always monitoring things. We're always having conversations, but there's nothing specific on the table. It's always important to remember as you fixate on the last few things that might be hanging out there that we already did, 95 or more % of what you can possibly do to address a pandemic from the social distancing perspective. We did all that early on. And so, we end up arguing and discussing, a relatively small universe of potential areas for spread. So we keep looking at all of that. We continue, you alluded to masks. We're very strongly, encouraging everybody to follow CDC guidelines on that. And as far as the timing, it's April 9th today. April 30th is 3 weeks off. So, it's not an urgent conversation to have. Right now, the federal, state, and city guidelines are basically all aligned around April 30th. And, I think we'll try to, listen not just to local, but also to state and federal officials on those matters as we try to adjust. Sometimes people will suggest to me radical departures from, national public health policy. Hey, let's do what Sweden did or something, and sometimes it's highly debatable that they're even accurately portraying what somebody else tried to do. But nevertheless, we're in America, and we're probably going to follow a lot of the things that you're seeing in other cities. Ultimately, what we did in Oklahoma City, though we acted faster than most any other city, we came to the game later because the cases came to Oklahoma later than they did coastal cities. And so we had the opportunity to act fast, but we largely did what was already being done around the country. We were largely following CDC guidelines. Our public health officials, read the same literature that the federal officials read. So if you're looking to see, where all this is heading, timing-wise or regulation-wise, look at what's happening around the country. Look at the CDC. It's not likely that we're going to go off in some totally different direction here in Oklahoma City. We're all reading the same studies and the same literature. So that's a long answer to your question, but bottom line is I don't see any further restrictions today, but we always obviously reserve the right to do the best thing for public health. And as far as the timing of it, April 30th remains an arbitrary date, but it's 3 weeks out, and we've got some time to kind of see how things go, and we'll probably move in some accordance with federal and state guidelines at that time.
All right, let's try Fox 25. If you have a question, please tell us who that would be to.
Hi, Mayor. This is Dan Snyder. This is for the mayor. We talked yesterday. You said you've also been getting those messages on social media that they are still seeing a large gathering. I just wanted to know, have police kind of confronted some of these large gatherings, and can people be fined, or are you more trying to educate people when they are in these large groups?
Yeah, so you can always call police if you believe that something is being done that jeopardizes public health and is in violation of the proclamations we've issued to protect public health. And police have responded to those situations. As far as I'm aware, in every single case, they have received compliance and therefore have not had to write any tickets. They have that ability, but we have not had anyone refuse, to my knowledge, to follow their requests. And so, I find my expectation is that, the vast majority of people are following these guidelines because they recognize why they're in place. They don't want to die any more than you and I do. And those who have chosen to violate them, they know what they're doing is dangerous and probably, morally wrong. And it doesn't take much to remind them. And so it doesn't surprise me that it just, in most cases, a police officer showing up and talking to them about the dangers of what they're doing is more than enough to ensure compliance. So, but we can't be everywhere at all times. We're not omniscient and we're not omnipresent. And, there's a few hundred police officers on the streets at any given moment, and there's 650,000 people in the city. So, we will always have to depend on reports, and we also have to depend on everybody trying to influence their own networks to take this seriously. If you know somebody who is participating in a basketball game or some other kind of gathering, you should speak up. You should remind them what's at stake here. As I said from the very beginning of this, as these regulations reach a more individualized level, you're going to have to be my partner in this. We don't have an army. So you're going to have to take this seriously for your own good and for the good of those you love. So that will continue to be our message. But obviously, we do have enforcement mechanisms that are available to us, but the practical effect of them is going to always be limited. It's a free society, and we have to have partnerships with the public in ensuring public health.
All right, I believe we have Janice from the Journal Record. Janice, you there?
Yes, can you hear me?
Yeah, who's your question to?
For Dr. Mack, hey, could you clarify something you said earlier about testing notification? There's been a lag and you took some of it in-house. What exactly is coming in-house? Just the notification portion or any processing?
Thank you. Excellent question. So what was being done is a private lab had been notifying physicians who would then notify clients of positive results and negatives initially, and then later what had happened is that quit happening, and we began to experience some complaints and concerns about that. And so what we determined to do was just take responsibility for that in-house. And so we redeployed some of our staff in our incident command structure into a call line, and they'll be making all of those calls to make sure that they are done in a timely manner and that they're not just lost to follow-up, which is a term that sometimes gets used in the medical community. But we will keep pursuing individuals to make sure that they get their results. Thank you.
Thank you.